We'd now like to welcome a previous Recovery Reinvented award winner and medical director of the Heartview Foundation, Dr. Melissa Henke, to the stage to provide the Narcan training. Dr. Henke.
I'm Dr. Henke. This is one of my favorite days of the year. So super excited to be here. Let's see, yes. Okay, so you'll notice that this slide is pink, and I'm wearing pink because my kids have a home game tonight, and it's pink night, and it's Pinktober, and I love that everything is pink in October. I love that we have uncomfortable conversations about breast cancer. I love that we talk about detection and prevention and treatment, and my hope is that someday we have those same conversations about substance use disorders and mental health, that we wear it proudly. So there's a lot of pink, and this is a lot of heavy information. This first slide is just the number of drug-involved overdose deaths, and I know we just listened to some of that, but that trajectory is not sustainable, you guys. We are losing people at a clip that is unacceptable to me. I started medical school in 1998, and at that time we weren't talking about overdoses. We didn't get any treatment. Nobody wanted to say a word, and now all of a sudden we're at 107,000, and people are maybe sitting up and taking notice, but not like they need to. More than 80,000 drug overdose deaths involved opioids in 2021. But it wasn't just opioids, right? There was 107, so there's others. This is not an opioid epidemic. This is an addiction epidemic. And fentanyl is driving this. Look at that trajectory, right? I mean, if that were like kids graduating from high school, that's a fabulous trajectory, but it is not, right? That is what is killing our young people. It is killing our families. Fentanyl is 50 to 100 times more potent than morphine, which means it comes in a very small amount. Guess what? You can order it from your phone, have it delivered to your house. You don't have to go to the street corner. You don't have to do any sketchy drug deals. You don't have to do any of that. You can do it right from your home. You can invite your drug dealer in. And that is what is driving this epidemic, and that is why we're going to talk about it, because it's made in clandestine labs all over. It's synthetic. It doesn't rely on a poppy plant, right? It's not like heroin where you need to grow something. You can just make this poison in a lab, and then they press it and they make it look like pills so that our young people think it's a medicine. They think it's safe. They think it came from a pharmacy. It didn't. There aren't fentanyl pills in a pharmacy. If there's a fentanyl pill out there, it came from a clandestine lab. But it is not just opioids, right? If you look at this gray line, that's fentanyl. But look at that yellow line. That's meth. The orange one is cocaine. And again, follow that back to 1999 when I was a med student. There was a reason we didn't learn about drug overdoses, right? That number is barely on the graph. But now look where we are. You know why? Because stimulants our fentanyl is combined with our stimulants, right? So if you think you're using meth and there's fentanyl in there, you don't make it. So I want to talk about fentanyl test strips, and I will tell you that these are not as available as they need to be. So what this strip does is if you buy drugs, you mix it together, you put the strip in there, and it tells you if there's fentanyl in it. Right now, ideally, people don't do drugs. Like, that's a perfect world, right? But fentanyl test strips save lives, because if you are someone who uses meth and you don't know there's fentanyl in there, that might be your last breath, right? So we have to have better access to these things. And fentanyl test strips are like harm reduction. And I used to think in medicine harm reduction was a dirty word. It's like, well, I don't want to reduce harm, I want to save lives. Well, guess what? Harm reduction does save lives. It is about meeting people where they are at in their recovery. I have patients all the time that come in to see me. They want to quit using fentanyl, but they're not done with meth yet. You know what I do? I meet them where they're at. I say, okay, let's talk about the fentanyl. Let's get that out of your system. Let's get the dirty needles out of your arm. Let's do the work so that you can live another day, because the only addict I can't help is a dead one. So we have to do the work to keep people alive. We can prevent overdose deaths, and we have to, right? We're seeing these numbers in ridiculously climb off the chart. And these are some other harm reduction services. And again, these things make us uncomfortable. Supervised consumption? What? Yep. So you're in a safe place when you use, so that somebody can give you Narcan, so that you can have a clean needle, right? What about naloxone? What about medication-assisted treatment with methadone, Suboxone, buprenorphine, naltrexone? Those are not dirty words. Those are life-saving medications that people need to have access to. So we need to have these uncomfortable conversations if we're going to save people's lives. I'm tired of going to funerals. I'm tired of reading obituaries. So is it happening here? Sure is. 2010, we lost 20 people in this state. 20 families, 20 communities, 20 lives lost. Look where we're at now. 132, 133, 115. Those aren't numbers, those are people. And they're gone. I can't help them. Nobody can help them. So this is why we're having this conversation. Who's at risk? Well, someone who's been in recovery and doing well, and they don't have drugs in their system, and they don't have that tolerance, and then they slip, they return to use, that person's at high risk. Somebody who just overdosed is at increased risk of overdosing again, right? This is not a rational disease. It makes no sense, but if you just had an overdose, you're more likely to overdose again. And somebody who just came out of detox or jail or an abstinence-based treatment, the people that lose their tolerance are at increased risk of dying. So what does an overdose look like from opiates? Well, we all know opioids are down, right? So what do? They slow everything down. Breathing goes down. Heart rate goes down. We stop breathing, we turn blue. Our pupils are pinpoint. So what do we do about it? Well, you shake them, you shout, get their attention. Please don't put them in a snowbank or put them in a cold shower or slap them around. Please don't do those things. If you can't wake them up, then you're going to want to call 911 and then give them Narcan. Put them on their side, right? Or do chest compressions if they're still not breathing. Give them more Narcan. Because guess what? Fentanyl is 50 to 100 times more potent than morphine. They might need a dozen doses of Narcan. You just keep giving the Narcan, do the chest compressions, keep them alive until help arrives. We're going to give you some Narcan here. I forgot to push out. So, yay, everyone gets to have Narcan. The good news is I don't even have to do the training on how to use it anymore because it's over the counter. How awesome is that? Right? Finally. So, and like Governor Burgum said, I got to do the first Narcan training at the first Recovery Reinvented, and people were not impressed. They were like, why are you giving Narcan? You're just encouraging people to use drugs. That is not correct, right? I mean, we wear seatbelts. Does that encourage us to drive really fast and crash into trees? No, it does not. It is a harm reduction measure, and that's what naloxone is. So I am going to give you the opposable thumb lecture, though, right? So this Narcan is a nasal spray. We can all do this, right? If we have thumbs? Okay, perfect. Then you can give Narcan. Just put it in the nose, use your thumb. That's it. Super easy, not complicated. Do it as many times as you need to, right? And again, over the counter, but we're going to give you some. It is only effective for opioids, not for benzodiazepines, not for alcohol, not for methamphetamine, not for xylazine, not for any of these other deadly drugs. But if you have fentanyl and methamphetamine on board, it can overcome the fentanyl, so give it anyway. If you see someone unresponsive and you don't know if they had a heart attack or a stroke or their blood sugar is 1,000 or their blood sugar is 12, give them Narcan. You're not going to hurt them, right? You give it, you do the chest compression, call 911, you do all those things, and if it turns out it wasn't an overdose, oh well, you didn't hurt them in any way. This is not a substitute for emergency care. You still need to call 911. They still need to get to the hospital. Time is important. Our brains need oxygen, our hearts need oxygen, and so we have to get people where they need to be. Multiple doses may be necessary, and if someone is physiologically dependent on opioids and you give them Narcan and they go into withdrawal, they are not going to be happy, okay? But they are going to be alive and not happy, and I take that over dead. So if they come up swinging, if they come up puking, clean yourself off. You'll be fine, okay? So Good Samaritan laws. Basically, in North Dakota, we have a Good Samaritan law that says if you witness an overdose, you call 911, you stay on site until help arrives, and you cooperate with law enforcement. 3 people in the room are immune from prosecution for possession or ingestion charges. Don't let someone die because you're afraid to go to jail, okay? My patients tell me all the time I wouldn't survive 24 hours in jail, but I'd be willing to take that risk. If I called 911, I think I could make it 24 hours if they arrested me. But I'm also confident that they would not arrest me if I did the right thing, okay? And according to North Dakota law, any individual is protected from any sort of liability for giving naloxone. Nobody can come after you later and say, well, you gave me naloxone and then I aspirated and now I have lung disease. It's like, yep, I sure did. And I'll stand proud and say, I'll do it again. So, take-home points. Carry Narcan. I carry Narcan in my purse. And I mean, the weather in North Dakota is horrible, right? It's either 100 below or it's 110 above. But carry your Narcan. If it freezes, it freezes, right? It's better than nothing. Don't be afraid to use it. You can use it on babies. You can use it on nursing home people. It does not matter. Just give the Narcan, okay? Fentanyl is driving this overdose epidemic. We have to have these hard conversations. We have to sit down and we have to talk about prevention and detection and harm reduction and treatment and all of those things, and we need to do it everywhere that we are, right? Because that is how you get rid of shame and stigma, is you normalize the conversation and you tell people that they matter, right? Nobody is less than. Nobody in this room is less than. Harm reduction saves lives. It does. You might not like it. It might make you uncomfortable. Still saves lives. Show compassion to anyone and everyone that you meet because you do not know the struggle that they are going through. You can't. So just be compassionate and use your voice. So we can't heal the world today, but we can begin with a voice of compassion, a heart of love, and an act of kindness. And at the end of the day, if you do those things, the world will be a better place. So thank you.